Hi, I'm Dr. Shuparna Bhattacharya, consultant at Nova IVF Fertility East. Today, the topic of discussion is BMI, that is body mass index, and its relation to fertility. Most women with their weight have no problems in conceiving. It is the underweight or the overweight which usually have the problems in conceiving. Now, it not only restricts to women but also men are included in it. What do we actually mean by underweight and what do we actually mean by overweight or obese? By that, we calculate the body mass index of the patient. If it is something between 90 to 24, that is the normal average body weight. Anything less than 19 is underweight and more than 25 is overweight. More than 30 is obese. Now, what is the problem during this? Why does the weight become an issue and why is it a problem? Women with less weight and overweight have irregular periods, as a result of which they do not make eggs, that is an ovulation, and thus the pregnancy does not come in. Now, with overweight women, there is a hormonal imbalance, there is insulin resistance, and more of the male hormone, the LH hormone, which results in anovulation. So it's a vicious cycle and they have problems menstruating. With irregular periods, they really do not know when it is a fertile period. Now, what we have seen in women who have conceived also, they face problem because of this weight issue. They have an increased tendency for cesarean section, they have an increased tendency for miscarriages, and they have a preponderance for diabetes and pressure during pregnancy. As an infertility specialist, when we come with these overweight women, to stimulate these women becomes very difficult for us. We have to use higher doses because of their BMI, and they produce lesser eggs and lesser quality of eggs. So it becomes very difficult for us. Similarly, in cases of men with overweight, they have reduced sexual functions, reduced libido, poor sperm counts. So when we advise both men and women to keep their weights in control, go for a diet, exercise, lifestyle modifications, and of course the treatments which we provide them, which will help them to conceive. Thank you.